to be educated, but I'm so frustrated.
What's up, guys? It's Dr. G. I hope you guys are doing great today. So I am coming on to talk to you guys about moonlighting. As you all know, I'm in third year and I've started moonlighting. Moonlighting basically just means your secondary job outside of residency. So normally when you start residency within that first or second year, in the contract they'll tell you you're not allowed to have like a outside job outside of residency, just because, well, you know, you're basically here to train and really more of your focus should just be on the residency schedule and what you're here to do. But when you start getting to your third year, now you're not doing so much of the inpatient work anymore. It's more of outpatient, and a lot of times too you have days off, especially your weekends. Oftentimes your weekends will be off. You can do with that as you please, basically. So some of us will prefer to basically find like secondary jobs out there to see what we can do with ourselves, because you can only watch Netflix for so long, you can only hang out for so long, and sometimes too, like, you're thinking, listen, those student loans are not going to pay themselves, so we might as well start, you know, pushing that debt down some. But anyway, that's where the question of moonlighting comes in. So 4 things I'm going to talk to you guys today about with moonlighting. It's really just about like moonlighting eligibility, types of jobs you can do in moonlighting, schedule, and then the average pay when you're moonlighting and stuff. These are 4 things I'll talk about today. So I'll start with the first one. As far as moonlighting eligibility, it's program specific. Every program is different. My program says about your third year you will be okay to moonlight. But the other thing, as far as like being eligible, you do have to get like a program director's approval. So he'll basically write a letter saying she's on track in the program to complete residency, stating that the resident has been in good status the entire time. And then he gives you approval to start moonlighting. Now you can then reach out to like the job recruiters and stuff, especially whatever area like you want to moonlight in. The one thing that's also important too before you start moonlighting is to get your license, because when we're in residency, the DEA number and the physician license, which is the PIT, physician in training license, it's actually for the residency, well, for you, but from the residency. So everybody does have what we call like an umbrella DEA. It's really just the same facility DEA with just like a couple of extra digits like behind that. It just kind of separates, differentiates one resident from the other, but overall it's the same institutional DEA that everyone uses and stuff. But when you do start moonlighting outside of your residency, now you do have to get your full physician license to be able to moonlight in those facilities, depending on what facility you choose to moonlight. So that's like the main criteria, like getting the permission from your program, making sure like you meet the eligibility criteria and stuff, like you are in good status with your program, like you're not on probation, you haven't done anything crazy, anything that will put you in a bad light, like to prevent them from giving you that approval. So once you get that, then you proceed to looking for jobs and stuff. As far as jobs, it all depends, okay? In residency, as far as what you can do beyond, like what you can do as a secondary job outside of residency, it's kind of limited. You don't have so many choices and stuff. One option, like for me, I like emergency room. So emergency medicine is a good one because they have so many like small little emergency rooms and stuff that need doctors to kind of come help them out. So that's a place to moonlight. Some people also moonlight in the same hospital where their residency is. My residency didn't allow us to moonlight in the same hospital, so I go to different hospitals. If you don't like emergency medicine, other options there are urgent care. I also looked into like moonlighting in urgent care. I used to work in the urgent care as a nurse practitioner. Quite frankly, I didn't pick the urgent care option just for like 2 reasons. Like, I already know that territory, like I know what to do there. The second is a compensation. It wasn't that impressive for me and stuff. And actually the third reason is really also because I want to go into emergency medicine. So I think the sooner I start like, you know, gaining that experience, basically kind of getting my feet wet in that setting, it will be basically a better option for me. Okay, so another option for jobs as far as like moonlighting and residency also is like, so there are like Medicare insurance companies and stuff, like they reach out to you to certify their patients and stuff, like United Healthcare, Advantage Healthcare. They reach out to you to basically do like a recertification of their patients, like they do that every year, but it'll be like a part-time thing, like on the weekends and stuff. You go to a facility and then screen their patients. It's really like a whole bunch of paperwork that you have to do for them. So you screen like the older adults that are actually on their like insurance plan and stuff, and then fill out that paperwork and then basically like send that back. Like I said, it's just a part-time thing. So that's with the insurance company. Different insurance companies do that just because they do have to recertify like their Medicare insurance patients like every year. So that's an option as well. So I've listed emergency room, this urgent care, this working with the insurance companies as well. There is telemedicine also. Behavioral health is an option as well, but you don't get to do too much with that one. But telemedicine is an option. And the final one is hospital medicine. Hospital medicine is an option for moonlighting. Just keep in mind, like the jobs that you do get for moonlighting for hospital medicine as a resident, there are not that many opportunities out there, but it's available. And a lot of times it's really from like word of mouth and stuff to see, okay, who's looking for help and who needs like a resident to kind of help them out. And as long as you're willing to work on the weekends, a lot of these places are willing like to have you on. They also want to hear good recommendations about you in your residency. And of course that starts with your program director, coordinators, faculty that you've worked. As far as the schedule, most times it's usually a weekend thing. Like I said, now in third year, most days, like I really work like Monday through Fridays and stuff, and then my Saturdays and Sundays are off. Well, for me, it's a little different because I'm a chief resident. So on Fridays, I have administration time. So maybe I'll be like in the clinic or rotation in the morning on Fridays, and then in the afternoons, so around noon or 11:30 or so, I have the rest of the day off to really just kind of take care of residency stuff. So if I really have nothing to do, just go moonlight in the ED, maybe do an overnight that kind of leads into a Saturday. For the emergency room, for us, we have the opportunity to do 24-hour shifts, do 48-hour shift, 36-hour shifts, whatever you can handle. I know those are crazy, but the 24-hour shifts are not that bad. I've only done one 48-hour shift in the emergency room Friday nights leading into Saturday, and then Sunday morning, stuff like that. In the slower paced EDs and stuff, it's not so bad, but it really is exhausting. So for me, I think I'm getting into the schedule of just trying to keep it at a 24-hour shift, like do my full 24 on a Saturday, and then have a Sunday off, and then Monday resume residency work again. I also know some other people, I do that sometimes too, because we're allowed like a full month of vacation and residency. Some people also take some of their days to go work somewhere. And as far as the pay, the compensation really varies depending on where you're working. Like the Medicare, the reimbursement one, that one will probably be like $800 to $900 or so, like in a day or something like that. And then say urgent care will start from like 50s, and ERs can go from 125 to 150, go into the ranges of 200 an hour. But it really does vary depending on location. Of course, the busier the facility, the more you'll be compensated and stuff. So I really like, these are like the possible options of where you can moonlight and stuff. So if you guys have any additional questions regarding moonlighting and residency, or just any specific questions that you have, feel free to email me, text me, whatever it is and stuff, and I'll respond to you guys. So I'm gonna head out now because I do have to run to a nursing home. I have a patient waiting for me there. Until next time, guys.